This is One on One. Hi, Steve Adubato. I'm pleased to be here with Warren Geller, who is the President and Chief Executive Officer of Englewood Hospital and Medical Center. And we are on the rooftop, not for any particular reason other than the fact that we are standing across from an extraordinary facility that we're about to go in and take a look at, talk about that facility.
Yeah, thank you, Steve, and thanks for coming to Englewood Hospital today. This is our brand new state-of-the-art comprehensive 180,000 square foot cancer treatment and wellness center that we're delivering to our community.
Describe it. What is it and why is it different than any other quote-unquote cancer center?
It's everything from radiation oncology, infusion therapy, operating suites, to your super specialists all in one location. So you could have your visit, you could have your pre-treatment, your actual treatments, and then your follow-up treatment all right here in this beautiful building behind me.
Before we go in, we're shooting actually in May of 2015. This is going to officially open in 2016. But as we speak, you were just telling me, Warren, before we started the interview, that people are being treated right now, even though the completion doesn't happen with the entire building for several more months. How is that happening?
My guys were very creative in that they flipped this project upside down on its head so that we could deliver the services 18 months before anticipated. So our radiation oncology unit is already opened. Infusion therapy, we're currently treating 900 treatments a month. And we actually just had to order about 2.5 years sooner than we anticipated our second radiation oncology machine because people are staying home for their treatments.
Ready to go inside and take a look?
Absolutely, let's do it.
Warren, now we are inside, in fact, the Cancer Treatment and Wellness Center at Englewood. Talk to me about the fact that we're just telling me off camera that there's been an 80% increase in the demand for outpatient cancer service?
Yes,
treatment.
We spent years crunching the numbers and doing this plan. Started way back in 2010. And if you look at what's happening in Bergen and Hudson counties, we're not growing, but we're aging more rapidly than other parts of the country. And as you age, 65 and over compared to 65 and under, you have a 10 times greater chance of fighting one form of cancer, never mind multiple forms as you're treated throughout your lifetime.
And you know, you talk about multiple forms, and the other thing that's interesting about this cancer center is that you're really going after high-profile physicians, oncologists, in a multidisciplinary approach. Why is that relevant?
It's extremely relevant because it's really about the doctors and making the doctors available so people don't have to travel for their consultations and then their subsequent treatments. Whereas if you could recruit all of the experts, and thankfully we've had 8 years in a row of an operating surplus from our main operations, so that's you could buy the technology, the latest and greatest, but now you need to do it in a special environment. And how do you do that? And you saw some of that outside on what we're trying to accomplish.
You know, we talk about the fact that it's interesting, Englewood is located in obviously very close to the George Washington Bridge, and we were upstairs and we're up on the rooftop. You were saying right over there by the bridge, New York. That whole issue of people having the option of going over the bridge, across the bridge, or staying here, that's changed for people in many ways.
All of these physicians, these experts, they trained in the same places, and they've chosen a different lifestyle where it's okay to practice in the suburbs. And again, keep people right here, because if you need 28 treatments of radiation therapy, part of your wellness is going to be how easy is it on your friends and family when they're bringing you for those treatments? That's not always easy.
You know, we're in this extraordinary facility, and what Warren was telling us just a few minutes ago, as you're watching, is that even though this is being built as we speak, people are being treated as we speak. Talk just a little bit about the kinds of treatment that people will experience in this center that heretofore hadn't happened before, specifically.
Yeah, specifically, if you think of radiation oncology, over the years, typically in healthcare facilities, they were put in the basement and we would make up fancy words for it. We'd call it the lower level. But the reality was it was down, around a corner, there wasn't any natural light, it wasn't a great place to be cared for, no matter what the technology and the experts' availability was. But now, in less than 100 yards, after making a left turn off of the street here, you meet the same valet, the same concierge, the same therapist, the same nurse, and the same physician for every single treatment. It's very easy on people.
And set up, we're about to talk to your colleague who you brought in here to run the operation. And before our folks meet him, tell everyone who he is and why he matters.
Yeah, Dr. Stephen Brower is being brought in to be our medical director at the Cancer Treatment and Wellness Center. He's an expert, major oncologic surgeon who spent the last 25 plus years practicing at New York City and some other very prestigious institutions of caring for people, but maybe even more importantly, embracing the physician community, embracing those around him, collaborating, because we're in this collaborative era of healthcare, because it's not one person in that treatment, it's a multidisciplinary approach.
Thanks, Warren.
You're welcome. Always good to see you, Steve.
Warren talked about this gentleman right here. He's Dr. Stephen Brower, who is the medical director here at the Cancer Center and also the chief of surgical oncology at Englewood. Let me ask you this, doctor. The exam rooms that we're seeing all around us here at the Cancer Center, describe what's going to go on here and why it's important and special to the patients who will be treated here.
So, you know, the odyssey of a patient going through cancer is pretty complex. So we've got to pull together experts, confident, top of their game, who can ensure that the outcome is going to be right for each and every patient. But in addition to that, we have to marry that with understanding that there's a human being around that treatment, and there's a family, and that the minute I give a patient a diagnosis, well, you have cancer, that can turn a life upside down and a family upside down. So we've got to be humanistic in all of this. And one of the things that I am most proud of is how this cancer center and this medical center has committed to that. So what does that mean in the rooms? That means that I can't just tell a patient, okay, you're going to need surgery, or you may need radiation therapy or chemotherapy. I need to understand what that means over the course of the time they're in the hospital getting surgery, the time they're recovering at home, how we're going to support them. So in each of these rooms, there are going to be specialists in nutrition, in wellness in general, in treating all of the other pieces of their physiology that will impact on a great outcome.
That's cancer treatment?
That's cancer treatment. Treating their diabetes, treating their heart disease, treating their nutritional status, vitamins, it all impacts, and it impacts on what we call the host, which is you and me, and how we take care of our cancer. So
the aesthetics matter too, because I've been struck by what it looks like physically.
Well, you're not kidding. And in fact, there have even been scientific studies in some of our better journals that say this kind of environment, the beauty of this environment, the serenity of it, the privacy of it, leads to better outcomes.
Why?
It's better being involved in this kind of facility with the support expertise than having just someone looking out on a parking lot, or being in a room where it's enclosed, where there's anxiety and fear. And whether it's music therapy or art therapy or pet therapy or nutritional support, hey, I'm a surgeon. I'm a get in there and do it right. But I know that these other pieces are just as important for my patient.
Doctor, talk to us about the connection, if you will, between the technology and the clinicians. How much does that matter?
Okay, Steve. So we spoke a little bit about expertise, and we have to have the physicians who are trained at the top cancer institutes that will be treating here. We have that. We've also got to recognize that cancer centers' main missions are to identifying healthcare disparities, on ensuring that the quality outcomes are at the top, ensuring that we understand national quality metrics and that we are comparable to any metric, that we can gather data and information from our electronic records and look at our outcomes, and also marry this with the incredible technology, as you bring up, in cancer. So whether it's understanding gene therapy and genetics in terms of how that influences our patients with breast and colorectal cancer and lung cancer, or whether it's me, surgeons doing minimally invasive cancer, protecting the normal organs, or it's a medical oncologist diminishing their toxicity, because our patients are being cured of cancer now. They're surviving. We need to ensure that their survivorship is great. And so this is also what our cancer center is dedicated to. All of this technology, from gene therapy to targeting treatment and how we're going to deliver that, we can do it all in one building here.
Thank you, Doctor.
You're welcome.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, NJIT, New Jersey Institute of Technology, New Jersey Natural Gas, MD Advantage Insurance Company of New Jersey, New Jersey Sharing Network, Cone Resnick, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.